What's up, everybody? Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Maggio. Thank you so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you're currently injured and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you're frustrated as hell, you just want to know what's going on and get your problem figured out, you can reach out to us directly and request an injury consultation. All of the information to do that is available in the show notes or wherever you're consuming this episode. Now that we got the boring stuff out of the way, let's jump into the episode. So in this episode, I'm going to be talking specifically about surgery for what I call a musculoskeletal injury. Tough word to say, musculoskeletal injury. Specifically to the bone, to the cartilage, to the disc, to the ligament, soft tissue, which can include the muscles and what's called the fascia, and the tendon. I'm going to cover more specific surgeries for different types of injuries in the future, but I wanted to really have like a baseline episode for it to start to give you a better idea of considering all the options, especially for surgery. And the way I wanted to break this episode down, very similar to how I did the last episode on cortisone shots and epidurals, but really going into the good, the bad, and the ugly. So let's start with the good part of surgery. Like, let's say you get into a car accident. Maybe you fall in a hole. Maybe you fell off a building. I don't know. Some type of like direct impact, direct trauma. Surgery would be a good option, and usually as soon as possible, to stabilize the area. And it's going to allow someone to function better and get out of pain. And then there's another situation where it's good, where they do the surgery on the thing that is actually generating the pain. It fixes the problem and you feel a heck of a lot better and you function better. Those are some good things on surgery. So it might sound like I'm becoming pro-surgery to start, but that's just the good. Got to present both sides. Now the bad. First off, it might not even fix the problem or the pain. You say, what'd you say? Yeah, it might not even fix the problem or the pain. A lot of times what's happening with surgeries is they're seeing things on an MRI, an X-ray, and then they want to be very what's called reductionist thinking. They're like, that's got to be the problem. They cut somebody open, they go in and do it, but it wasn't the problem in the first place, and it didn't fix anything. That sucks. Another bad. There could be a reaction to the anesthesia. Oh, never talk about that. Yeah, there could be a big reaction to the anesthesia. You might have trouble waking up. Could have issues with the heart. Could have all sorts of things. There's risk when you go under. Anesthesia isn't like a normal thing, and you do that, there could be a reaction to that. And I've seen that. It's happened to lots of people. The next one is just infections and swelling. Yeah, you can have an infection. Like, I've seen people have to get multiple surgeries because an infection got in there. Lots of swelling. Like, they don't tell you the extremes of all that, like how bad the infection can get and how bad the swelling can get. There's people that have had horrible issues over the years. There was a guy, I think he played for the Washington Commanders, also known as the Redskins, and he broke his leg really bad, and he ended up having like 6 different infections and just got worse and almost lost his whole leg. So I bet they weren't thinking that was an option when they went in there, but it is something that can actually happen. Now the ugly. Here's the ugly of surgery for a musculoskeletal injury. Not only did it not fix the problem, it could actually make it worse. Imagine that. Someone goes in for surgery. They want their problem to go away. Not only did their problem not go away, it got way worse. Yeah. That happens more often than it should. And the last ugly of all, death. Yeah, that's right. Death. Yeah, they could actually die on the table. Could have a reaction, die on the table, bleed out. That's some ugly stuff. So now that I covered the good, the bad and the ugly, let me talk about a problem in healthcare. And it's just as much the doctor and the provider's fault as well as the client or the patient. This idea of like passive versus being active in the treatment process. So many people just want to be passive. They're like, all right, I'm just going to get this surgery. I don't want to have to do anything. And the doctors, honestly, they make it out to be this awesome thing. It's going to be simple. It's going to be easy. I think of in The Wizard of Oz when they put the scarecrow back together. They're like, cut here, stitch here. Everything's good to go. That's what's going to happen. That's what they're telling you. They're like, we'll just go in there, cut a few things, sew it up, be good to go. But they don't really inform you of all the extensive rehab that's going to happen from that. You're going to have to go through some really painful times to get things moving. They're not going to be there on the back end to do that, so they don't care. They don't really tell you that. Like, it's going to be a very extensive rehab. It's going to be very painful. And in some situations, you might actually be immobilized for a little while. Like, say you have surgery on your right shoulder, and say your right shoulder and your right arm is your dominant arm, and you use it for a lot of things. Maybe one thing you use it for is like going to the bathroom. I know this might sound a little crude, but you go to the bathroom and you need to clean yourself up afterwards. You no longer have that option with your right hand. So either you got to get really good with your left hand, or hopefully you have a partner or a spouse or someone supportive that can help you. But they don't tell you about that you're going to be immobilized for a long time. The physical therapy is going to be hard as hell, that you're going to have some infections. There's going to be some swelling, that the problem could actually get worse, or it won't fix the problem. They don't tell all that. They just paint this rosy picture of it's going to be this great thing, simple and easy, we'll be in and out, and they don't actually tell you all the details. Like I said, I want people to be properly educated and informed so they can make the best possible decisions. And the orthopedic surgeons are not doing that. They're not giving you all the data. Like if they're like, hey, you could possibly die from this. This could actually not work. You could have an infection. Like, you're going to have to do all this extensive rehab that's just going to make you in more pain. Like, maybe you would consider, maybe this surgery isn't the first option I should do. So when should surgery be the option and also have like a high likelihood of being successful and reducing pain? One thing that I always look for is like that idea of like trauma versus no trauma. Like I said, if someone falls in a hole, gets in a car accident, falls out of a tree, I don't know what happens. Like, that's trauma. Surgery is going to be a very good option for that. But when I see no trauma, where it's like, hey, I don't really know what happened, it kind of came out of nowhere, that's a lot of compensations. And a lot of times in a compensation pattern, what happens is the area that's hurting is usually the one doing all the extra work. It's coming from somewhere else. And then people will get that area. It'll show up on an MRI. They'll be like, oh, the disc is blown out or the cartilage is blown out. They never answer the question of why that is happening in the first place. The next thing is, I call it being a human program. Yeah, once again, being a human program. So are you drinking enough water? I'm sure that 90% of people aren't drinking enough water. They're severely dehydrated. They're like, oh, I don't want to drink water. I'm going to pee a lot. It's like, you're an adult, drink some water, be a normal human. Next one is, are you on a decent movement program? And I'm not talking about like getting off the couch and going to the fridge and going back in. Like, are you moving your body, being basic, getting your steps in, and even if you're in pain, you're still moving and trying to keep things going, because movement is life. Next one is proper sleep. Are you getting proper sleep? Most people aren't. They're tossing and turning all night. They're not getting good restful sleep. Of course, they're not going to be able to heal. Next one is, are you not eating shit? Most people, that's like a non-starter for them. Like, they're putting garbage in their mouth and they might think, oh, well, I'm eating healthy. I got a salad from McDonald's. It's like, no, you're not eating healthy. You know if you're eating healthy or not. And lastly, is the stress being managed properly? We're just a ball of stress and going crazy all the time, constant stimulation all the time, go, 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 and it's not putting us in the right place. So being a human, drinking water, moving, sleeping, not eating garbage, and managing the stress. The last one is, they've tried conservative care with at least 3 other providers, maybe a chiropractor, a physical therapist, massage therapist, acupuncturist. It shows that you're at least being active in the process and trying other alternative methods. Like, I have a lot of qualms with all those other alternative methods like chiro, PT, massage, acupuncture, but it's at least giving it a chance to see what can happen, getting the tissue moving better. I've talked about the idea of like scar tissue causing big issues in there as well, but it shows that you're actually taking active role in what's going on. You're not being one of those passive people that are like, well, I don't want to do anything. I just want my problem to be magically fixed. And I'm going to go to this magical surgeon that's going to, make me feel amazing. No side effects, nothing like that. Like, you have to be active in the process. And in all honesty, if all of the above has been done, like you're eating good, you're moving good, you're sleeping better, you had a direct trauma, or you've tried conservative care and it's still affecting the ability to function and participate in normal life, then surgery probably will be the best option. But you got to make sure you have all of that stuff. I've seen so many things where people just are stressed, eating like shit, not moving how they should, not drinking enough water, and then they actually start doing that. And it's amazing how much better they feel. They don't need that extensive, risky surgery. So, in closing, number one, surgery should never be the first option, but always the last, especially, like I said, when there's no direct injury or trauma. If someone is considering surgery, they also need to get multiple opinions. I won't share directly who my family member was in case they listen to the show. But I had an instance 4 or 5 years ago with a member of my family that was dealing with low back pain, and they just wanted to get one opinion. And I was like, well, let's get 4, because I really like to, was it 4? No, it was 3. Let's get 3 opinions and really have some fun with this and see how it goes. So first one, doctor said, oh my God, I can't believe that you're able to even walk. You need emergency surgery right away. I can get you in first thing tomorrow morning, because if we don't, you're going to be paralyzed. Okay. Next one said they were totally fine and nothing was wrong. And the third one said, no, it's actually not your back. It's actually your hip. Those are 3 very conflicting opinions. Some are very risky, some are not. So get multiple opinions. Imagine if you went to the mechanic and the mechanic's like, yeah, I don't really know what's going on. We'll just start, it's going to cost $5,000 to fix this problem. You'd be like, oh, you know what? I'm going to get a couple other opinions and see. And you'd slow down and you do that because, it's your car. But when it becomes the body, you're like, just go to the first person. Yeah, they seem pretty credible. They're a doctor and they have a white coat on. They must know exactly what they're talking about. I'm just going to jump in and totally ignore all the other warning signs and understand that, like, I am not doing my part of like eating right, moving right, sleeping right, but I'm going to get this magical fix that requires me to do nothing and magically fix my problem. I would also say there might be leprechaun riding a unicorn with magic beans, if that's what you're thinking too. You have to take an active part in your treatment. Slow down. Get multiple opinions. Do not jump into things, because it could literally mean the difference between life and death. That's all I got for you guys. Please support the show by sharing it with others that might need some help. And if you're looking for real answers about what may be going on with your own injury and you're just tired of getting jerked around by the medical system, then please reach out and request an injury consultation with our team. All the info for that is available in the show notes. I appreciate you guys, and I'll see you on the next one. Bye.